Stomach mesothelioma is an uncommon form of cancer that develops in the lining of the stomach. As with other types of malignant mesothelioma, treatment options for stomach mesothelioma aim to control tumor growth, reduce symptoms from the cancer or its treatment, and possibly cure the disease in some cases. The main treatment options for stomach mesothelioma include surgery, radiation therapy, chemotherapy, and newer targeted therapies. Often a multidisciplinary treatment approach is used that combines several treatments. Surgery is a possible treatment option if the stomach mesothelioma is resectable, meaning it can be completely removed. The main type of surgery is a gastrectomy, where part or all of the stomach is surgically removed. For stomach mesothelioma, the surgeon will typically perform a partial or total gastrectomy to remove the part of the stomach affected by cancer along with some surrounding healthy tissues and lymph nodes. A gastrectomy aims to eliminate as much of the tumor as possible. Depending on the location and size of the tumor, the surgeon may perform a subtotal gastrectomy, removal of a portion of the stomach, or a total gastrectomy, complete removal of the stomach. Reconstructive surgery is often needed after a total gastrectomy to rearrange the digestive tract. Surgery may provide the best chance of a cure if all visible cancer can be removed. However, stomach mesothelioma often spreads too deeply by the time of diagnosis for complete surgical resection. Even after complete tumor removal with surgery, cancerous cells may remain in the lymph nodes or other small areas not visible to the surgeon during the operation. For this reason, additional treatments after surgery such as chemotherapy and radiation therapy are usually recommended to destroy any remaining cancer cells. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells and shrink tumors. For stomach mesothelioma, radiation therapy may be used along with surgery and/or chemotherapy as part of an initial treatment plan to destroy any remaining cancer cells and reduce the risk of recurrence after surgery. It is typically used when malignant mesothelioma cells are found at the edges of the resected surgical area. Radiation therapy may also be used as the primary non-surgical treatment option for stomach mesothelioma if the tumor cannot be surgically removed due to its location or extent of spread. Examples include treating the stomach area with external beam radiation therapy or internally through brachytherapy. Radiation is often given after chemotherapy to synergistically enhance the anti-tumor effects. The goal of using radiation therapy is local tumor control. However, stomach mesothelioma is generally considered resistant to radiation, so higher doses are needed, which can increase treatment-related side effects. Chemotherapy uses anti-cancer drugs that are administered through and by mouth or topically to kill cancer cells. For stomach mesothelioma, chemotherapy may be used in different situations, as an initial treatment before surgery to shrink a large tumor and make it resectable, neoadjuvant chemotherapy, after surgery along with radiation therapy to destroy any remaining cancer cells, adjuvant chemotherapy, or as the primary non-surgical treatment for advanced or metastatic cancer. Platinum-based chemotherapy regimens are most commonly used based on their effectiveness against other types of malignant mesothelioma. Some examples of chemotherapy medications that may be prescribed include pemetrexed, cisplatin, carboplatin, and gemcitabine. Chemotherapy travels through the bloodstream, allowing it to potentially reach and destroy small collections of cancer cells that have metastasized to other parts of the body. However, chemotherapy can also damage healthy cells and cause various side effects. Multiple cycles of treatment given over several weeks or months may be necessary, depending on the chemotherapy regimen used and the individual patient. Careful monitoring of side effects is important during chemotherapy treatment and recovery. Targeted therapy uses drugs or other substances to identify and attack specific cancer cells while doing little damage to normal cells. Two newer targeted therapies used to treat mesothelioma are the angiogenic inhibitor bevacizumab, Avastin, and the immune checkpoint inhibitor nivolumab, Opdivo. Both drugs have shown antitumor activity in malignant mesothelioma. Bevacizumab works by inhibiting the growth of new blood vessels that tumors need to grow, angiogenesis, thereby cutting off the blood supply. It may be used along with chemotherapy. Nivolumab works by taking the brakes off the immune system so it can better find and destroy cancer cells. By blocking a protein called PD-1 that cancers use to hide from the immune system, nivolumab helps the body's own T cells attack and kill tumor cells. These newer targeted therapies are still being studied in clinical trials for safety and effectiveness when used alone or in combination with chemotherapy to treat stomach mesothelioma and other types of advanced mesothelioma cancer. They represent promising treatment options that provide more personalized treatment with potentially fewer side effects compared to standard chemotherapy alone. Other treatments that may help manage certain symptoms or improve quality of life include pain medications, nutritional support if a large portion of the stomach has been removed, and procedures to open blocked stomach passageways. In some cases, clinical trials of new investigational therapies for advanced or recurrent stomach cancer are an option for those who do not respond to initial treatments or when the disease continues to progress. Palliative care is also very important to relieve suffering and enhance comfort for advanced-stage stomach cancer patients. The overall prognosis for stomach mesothelioma is poor due to difficulties in early detection and aggressive spread. However, a multimodality treatment approach and ongoing advancement in newer targeted therapies provides some patients with opportunities for improved outcomes. Treatment is determined based on the extent of disease, performance status, and individual patient factors and preferences.